Welcome back, everyone. As COVID-19 cases continue to increase, and a report from the CDC suggests that ER visits in April were actually down 42% compared to this same time period last year. Yet heart attacks and strokes have not stopped for COVID-19. To combat this alarming trend, the American Heart Association and Loveless Health System took action, creating a new public awareness campaign called Don't Die of Doubt, urging you to call 911 if you're experiencing symptoms of a heart attack or a stroke. I spoke with Dr. Mark Benares, cardiologist at the New Mexico Heart Institute, to find out more about this campaign. Joining us this morning, we have Dr. Mark Benares, the cardiologist with the New Mexico Heart Institute. Good morning, doctor.
Good morning.
Doctor, first, I want to thank you for bringing your expertise onto our show this morning. We're talking about heart attacks, we're talking about strokes, but we're starting off with COVID-19 because it's on the minds of so many people here. And because of that, you've actually been noticing, and doctors across the world have been noticing, a decrease of ER patients coming in. Tell me why.
So we first started seeing this in the reported data from China, that their ER visits for significant problems started going down in December, January, and then we started seeing the same trend in the United States. And pretty much it was because people were thinking that the hospitals were being used for COVID centers and that any other treatment wasn't going to receive priority, and people were also then afraid to go to the hospital for fear of catching the COVID disease. And so it was very important then to recognize that trend and to react to it in order to make sure that people were getting very quick care for their heart attacks and strokes.
Now, doctor, can you tell me, why is this bad news for patients who potentially are suffering from a heart attack or a stroke?
So heart attack and stroke are very time-dependent diagnoses, and the quicker that a patient receives care, the quicker that we are able then to act in a definitive way, and then the better their outcomes are. And outcomes in healthcare are long-term problems like heart failure or lack of recovery from a stroke or even death. And so we want to make people. We want to have their outcomes be no residual problems from whatever disease they're presenting with.
Now, because of these low numbers, obviously recognizing that people who potentially were suffering from a heart attack or a stroke were not seeking help through the ER, there's a new campaign out, Don't Die of Doubt campaign. Can you tell me about that?
So the Don't Die of Doubt campaign is an effort of the American Heart Association to promote quick care for patients. And there's no change. We've been actually pushing this for the last 12 years, that it's very important that patients get efficient, rapid care for these life-threatening illnesses. But the Don't Die of Doubt campaign is a reminder of two things: that hospitals are safe, even in the presence of COVID. Hospitals may appear different, where the healthcare providers may be in protective equipment, but we're still providing very safe and effective and efficient care, and we're doing it with bearing in mind that that COVID is a threat, but keeping that in mind continually. And then the second aspect is that we want to continue to treat these diseases in a very, very quick way in order to improve the outcomes.
In addition to, some patients may be concerned about going to the ER because of COVID-19, some may be doubting that they have the symptoms altogether. Can you go over some of the symptoms that we may be looking out for in case of some type of heart attack or stroke?
Sure, thank you. The symptoms of heart attack are chest pain or shortness of breath that doesn't go away quickly. And a lot of other diseases can cause this. However, what I tell my patients is that it's our job to make sure that this isn't something that's completely dangerous. And it's really not their job to assume that it's something that's not dangerous. And the symptoms of a stroke tend to be rapid onset of facial droop, of difficulty speaking, of muscle weakness, and or lack of coordination, and it tends to be very quick onset. And these need to be addressed in an emergent way. So by triggering the 911 system and having the emergency medical system initiate treatment and then notify us early so we can be prepared for the patient's arrival at the hospital.
Now, doctor, I've heard that the symptoms for women can be different when it comes to a heart attack versus a man.
So the number one symptom of a heart attack for a woman is chest pain. And so just because a woman is having chest pain doesn't mean it's not a heart attack. So women can present with other symptoms, as can men. And if you look at it, women do have some other variable symptoms, but chest pain and shortness of breath are by far the most common symptoms, both for a man and a woman with a heart attack.
I know a lot of our viewers may be thinking, I want a little bit more insight, a little bit more information. Where can they go to find out more details about this?
So New Mexico Heart Institute and Lovelace have excellent information on our website. Theheart.org is American Heart Association's website, and they have some excellent videos as well on there about the Don't Die of Doubt campaign and about systems of care. And so I'd urge the viewers to explore those sites.
Doctor, I want to thank you so much for joining us. Some great information that you've passed along.
Great. Thank you very much for the time.